everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. In today's discussion, in this presentation, we'll be discussing about anatomy of the orbit. Now, we'll come more in detail about orbit in the next slides. Orbit is nothing but that cavity or the space on the face where eyeballs are located. Okay, these are the points what we are going to discuss in this presentation. What are the anatomical planes? Okay, that will help us to explain the anatomical positions better. Dimensions of the orbit, right? Means I already mentioned that orbit is the cavity or space on the face where the eyeballs are located. What are its dimensions? The vertical measurements and horizontal measurements. Bones of the orbit. Okay, how many bones are used to make that bony cavities? It is not only one. Okay, there are more bones. So the bones, the names of the bones that is making up the orbit, and there are some openings inside the orbit. Okay, that is called fissures or canals. Okay, there is a superior and an inferior orbital fissures. We'll see that. And there are some sinuses called as paranasal sinuses. Okay, you might have heard about sinusitis. Okay, it has some relations to it. We'll discuss that as well. And also, what are the contents of the orbit, the orbital septum, the periorbita. We will not be discussing much about that, just a brief informations on that, as well as the contents of the orbit. Basically, there are three anatomical planes. So we'll discuss about anatomical planes in this presentation on this part. Anatomical planes is nothing but the way how we cut across our body, so that we will be able to explain the anatomical parts much more in detail. And also, if you want to explain the structures inside our body, we need to cut across, then only we'll be able to see the structures inside. So why we are keeping these three different planes is when we are explaining, okay, there will be a uniformity. Okay, otherwise if you do not say specifically, okay, how are we going to cut, it will be difficult for people to imagine. Okay, so basically there are three planes what we're using. One is coronal plane, another one is sagittal plane, and the third one is axial plane. So as you see in the picture, when we cut across the coronal plane, so this is the coronal plane, right? This is the coronal plane. When you cut across the coronal plane down, we can make the body into two halves. One is the posterior half, another one is the anterior half. So you can see corona or coronal plate, that is the, so when you cut across the coronal plate, you will get the body into two halves, anterior half and posterior half. Now you can see this is the sagittal plane. Sagittal plane is nothing but when you're cutting it across, again from the superior to inferior, top to bottom, exactly through the center of your face, the center of your body. So when you cut across the sagittal plane, you will get two equal halves of the body, right hand side half and left hand side half. Okay, so when you cut across the sagittal plane, you will get two equal halves, right hand side and left hand side, and both will be equal, okay, in structure, right? But when you cut across the coronal plane, you will not get equal parts, means similar parts. The posterior part will be different from the anterior part. Now you can see one more section, that is the axial plane. We are cutting it across the body. Okay, so here also you will not get two equal parts because the superior part is different from the inferior part. So when you cut across the axial plane, you will get the superior part and inferior part. When you cut across the sagittal plane, you will get two equal halves towards right and left. And when you cut across the coronal plane, you will get the anterior part and the posterior part. Right, so you might be wondering why we learned about the coronal plane, the sagittal plane and the axial plane. because those terminologies are needed when we are explaining the skull. Okay, before we go into the orbit, we'll have to talk about skull. So skull is nothing but the bony part of your head. You can see it. Okay, the bony part of your head. Within that, our brain is located. Okay, and here is the orbit. Within that, your eye is located. So skull is nothing but the bony cavity within which the brain is mainly located. So you can see that it is not a single bone. Okay, and it is made up of multiple bones. And you can also see that we can before we go into that, the skull is divided into cranium and face. Okay, so this is the cranial part and this is the face part or facial part. Now this is a view from the superior portion or upper portion of the skull. You can see that there are different bones that is used to make the skull, and you can also see that there are some junctions, right? This is the junction of the orbit, sorry, this is the junction of two bones or three bones. You can see all these junctions, right? So there is a name for this junction. Okay, this all these junctions name, you can see that suture. Okay, suture is the name of the junction between the bones. So there is a suture here. Okay, you can see the name coronal suture, and you already know that coronal plane. Okay, we will cut across the coronal plane, we will get the anterior portion and posterior portion. So we have a suture here that is called coronal suture, and we have a suture here that is called sagittal suture. Now we understood what is sagittal plane. Okay, when we are cutting across the center of the nose across the body, you will get an equal right hand side and you will get an equal left hand side. So this is a sagittal suture. So suture is same, right? Suture means junction between the bones. And now there is one more suture here. Okay, this suture is named as lambdoidal suture. Okay, now this is looking like lambda. You remember the lambda, what you have learned in physics? Okay, so that is why this suture is known as lambdoidal suture. Now we will just quickly look at what are the names of the bones. You can see one bone here, you can see another couple of bones here, and there is one bone here. So the name of this bone is frontal bone. Okay, that means it is in front. You can see the nose here, so this is frontal bone. Now we can see two similar and almost equal bones, that is, so this bone is known as parietal bone. Okay, so you have a left side parietal bone, you have a right side parietal bone. So there are two parietal bones and there is one behind, that is the occipital bone. So these are the three types of bones that is making up our skull, right? So that is your frontal bone. Okay, parietal bone right hand side, parietal bone left hand side, and there is occipital zone. And another thing what you can need to remember is name of the suture. Suture is nothing but the junction between the bones. Okay, so you have sagittal suture, you have coronal suture, and you have lambdoidal suture. Okay, the name is because it looks like our lambda that we learn in physics and mathematics. Alright, so now we are seeing the orbit. Okay, now we are seeing the whole of the skull. You can see this is the whole of the skull, and we learned that the skull has two parts, right? One is a cranium, okay, basically in which the brain is situated, and there is a facial part. Okay, the skull has the facial portion. So this is the front portion, and you can see that. And now you may be remembering what is the name of this bone. This bone is a frontal bone. That is a bone that is seen in front. So we have frontal bone, and you can also see the parietal bone here. We will not be able to see the occipital bone because it is behind our head. Now can you see this cavity, okay, or this space, or this opening, or this it is like a space, okay, or it is a cavity in which our eyeballs are located. And you can see some openings also here Okay, these are the openings through which the nerves and blood vessels will come to the eye or will go from the eye. We'll discuss about those later. So now you can see that this is a frontal bone and this is the orbit, which is the right eye orbit, and this is the left eye orbit. All right, now we are coming into the definition of orbit. So what is orbit? So orbits are bony cavities. Now we understood what is cavity, that is a space, bony cavities on either side of the mid-sagittal plane. Now we know that, imagine if this is the cranium, this is the sagittal plane, right? So this is a sagittal plane. When you're cutting it across here, sagittal plane. So bony orbits, orbits are bony cavities or bony spaces on either side of the mid-sagittal plane. So this is a mid-sagittal plane. It is, our orbit is on either side of this plane. So this is one orbit here and this is another orbit here. You can see the eyeball sitting here. This is the optic nerve and eyeball. So on either side of the mid-sagittal plane of the skull below the cranium. Okay, so cranium is on the top right, within which the brain is situated. Then what does they contain? Okay, the orbit contain eyeballs. Yeah, it contains eyeballs, the extraocular muscles. Okay, the muscles that is connecting to the eyeball, that is called extraocular muscles. Orbital nerves, the nerves that is coming into the orbit. Okay, you can see that. Blood vessels. Okay, there are a lot of blood vessels that is coming to the eyeball, and connective tissues, or the tissues that is connecting between these structures. Okay, so it is now easy to understand. We know that orbits are bony cavities, nothing but the space that is made up of bone. Okay, bony cavities on either side of the mid-sagittal plane. This is the mid-sagittal plane. Okay, on both sides of the skull below the cranium, and it contains eyeball, muscles, nerves, blood vessels, and connective tissue. Okay, here we go. Now we'll go a little bit deeper into orbit. So we understood orbits are the bony cavity. So this is a bony cavity. It's nothing but the space made up with a combination of bones connecting each other. So orbit has, now this is the orbit. Okay, you can see that this is a space in which the eyeball, muscles, blood vessels, nerves. You can see these nerves that is seen in yellow color, blood vessels are in red color, and you can see in brown color, those are the muscles. You have the eyeballs and the connective tissue inside, right? So orbit has four walls. It has a roof, it has a floor, it has a medial wall, and it has a lateral wall. So you can easily see that it has, this is the roof, this is the floor, this is the medial wall, that means towards the nose, and this is the lateral wall, that is towards outside. So roof, floor, medial wall, and lateral wall. Now if you can imagine this picture, we are seeing it above the cranium and the cranial part is cut. So that is why we are able to see the eyeball. That means we are looking from here and this part is removed. So we are seeing it, okay, from the upper portion. Okay, so this view is a superior view. Okay, so you can see the eyeball. And what are the features of these walls? You can see medial walls are approximately parallel. So you can see this is the medial wall, this is the lateral wall, medial wall and lateral wall, and this medial wall, two medial walls are parallel. You can see this medial wall and this medial wall are approximately, not perfectly parallel, approximately parallel. And lateral walls will make up an angle of 90 degree when you try to extend the lateral wall of right eye and lateral wall of the left orbit. It will make a 90 degree here. Okay, so that is why it is getting a shape of a cone. So this is a lateral wall, This is a medial wall. Okay, so medial wall, and you have another medial wall here of the other eye. So this medial wall and this medial wall are parallel. This is the lateral wall of the other eye. So when you continue the lateral wall here, and when you join this lateral wall, it will make an angle of 90 degree. Okay, right. So we come across a lot of information about orbit now. Okay, so we know that orbit is a bony cavity, a space that is made up of the combination of bones in which the eyeballs, muscles, blood vessels, and nerves are located. It has four walls: a superior, inferior, or the roof, or the floor, and the medial and lateral wall. So we discussed about that in the previous slide. Now we discussed about what is the shape of the orbit. Okay, you are all familiar with pear, right? Okay, and it is also a very good fruit to eat with. So the orbit has a shape of a pear. Okay, and also it has another way of saying it is a pyramid. And you remember what is pyramid, right? What we see in Egypt. Okay, pyramid has an apex, right? And pyramid has a base. Okay, triangular shape. Again, why we call it as a pyramid? It is a three-dimensional space. That is why we are not calling it as triangular. So the shape of the orbit, either we can say it has a shape of pyramid, okay, because it is having roof means the lateral wall, the medial wall, and the frontal means the roof and the floor. Or we can say it has a shape of pear. Now, why we are saying that it has a shape of pear? You can see the widest portion of the orbit is not exactly at the anterior most portion, and you can see this bone is coming curved, so this measurement is actually lesser than, so the widest measurement is slightly inside the orbit. As you see, if you look at the pear, it's the diameter here or the measurement here is smaller, but it is more wider, okay, just before the anterior portion. So that is why it is the orbit is having a pear shape, and it has a widest diameter of 1.5 millimeter inside the orbital margin. Okay, or otherwise we already discussed it has a shape of four-sided pyramid. Okay, so remember that shape of the orbit is either a four-sided pyramid or it has a shape of a pear. In this slide we'll be discussing about the dimensions or the dimensions. This dimensions is nothing but the measurements, right? So we discussed about now the shape of the orbit. Okay, we will not feel like it is having a shape of a cone or it is having the shape of a pyramid when we look from the anterior side, but when we look from the superior side we can easily understand that orbit is like a cone, right? Or it is like a pyramid. Okay, so what are the dimensions? So this is a horizontal measurement. Horizontal diameter is 40 millimeter, vertical dimension is 35 millimeter, so it's very close to each other, vertical and horizontal diameter. And from anterior to posterior, so this is the posterior part of the orbit and this is the anterior part of the orbit. So this measurement, anterior to posterior, this measurement is nearly 40 to 45 millimeter. That means 4 to 4.5 centimeter. So that is the dimensions of orbit. So anterior posterior is actually more than either the horizontal measurement or the vertical measurement. And you can see that here your orbit is actually bigger. Okay, it is much bigger than the corneal dimension. So you can see there are a lot of empty spaces here, right? All these spaces are filled with fat and connective tissue so that the eyeball can sit in a cushion. Okay, so even if somebody come and hit the eyes, you will not get the impact directly on the eyes. The eyes can go slightly inside, it can go towards right and left, it can move. Okay, so these empty spaces are filled with fat tissues and connective tissues. Alright, so in this slide we'll be learning about what are the bones of the orbit. So we already discussed that this space is made up of bones, or it is surrounded by bones. You can see this is the orbit here, this is the orbit here, and you can always see this suture. Okay, wherever two bones are meeting, those junctions are known as suture. This is a suture here, this is a suture, all these are sutures. Okay, so now for us to understand easier, each bones are given in different colors, so that we will see how many bones are utilized to make this space. Okay, it's not only one, there are around 7 bones. So what are the names of those bones? We'll see that. Now this one, as we already know, this whole bone is the frontal bone. Okay, so frontal bone, that is making up the major part of the roof of the orbit, that is frontal bone. Now you can see this pink colored bone, okay, that is zygomatic. So frontal is connecting with zygomatic. So you can see that the lateral portion or lateral margin of the bone, you can see the frontal is connecting with zygomatic. Now you can see a bone here, and you can see a yellow color bone here, you can see another pink bone here and blue color bone here. We will see what are those. All right, now this is this whole of your yellow color bone, that is maxillary bone. Okay, so the name of that bone is maxillary. So frontal, zygomatic and maxillary. So you can see maxillary and zygomatic are also getting connected. Now the fourth bone, that is known as sphenoid. Okay, that is, you can see the back side of the orbit, that is sphenoid. So basically roof of the orbit is made up of the frontal bone and the sphenoid. Sphenoid has actually two portions. Okay, this is a smaller portion of sphenoid, this blue color one, and this is the bigger portion. So bigger portion of sphenoid is known as greater wing of sphenoid, greater wing of sphenoid, and the smaller portion is known as lesser wing of sphenoid. So it is like a wing, right? A lesser wing and a bigger wing. Of course we will not call it as bigger wing, it is greater wing and lesser wing. So the fourth bone is sphenoid. Now you can see another bone on the medial wall. Okay, that is pink in color, it is known as ethmoid. Okay, so far we learned frontal, zygomatic, maxillary, ethmoid, right, and sphenoid. This is the greater wing of sphenoid and this is the lesser wing of sphenoid. So how many we learn now? 2 plus 4, 3, 5. Fine. Now there is another bone called palatine, but we will not be able to really see that palatine bone in the orbit from this picture. There is a small edge of the bone, that is the palatine. Okay, so that is the sixth one, the last one, seventh one. You can see that is known as lacrimal bone. Okay, so from there itself we can understand there is something to connect with the lacrimal, that means related with the tear fluid, right? This is the lacrimal bone. So we have completed the 7 bones: the frontal bone, zygomatic, maxillary, ethmoid bone, lacrimal bone, and there is another very small bone edge known as palatine. So these 7 bones are making up the whole of the orbit. So if you are saying in other word, 7 bones are connected to each other to create that bony space or create this cavity. Right, so we'll discuss about orbital walls a little bit more in detail, because now we learn the name of those 7 bones that is creating the whole of the orbit. So we'll discuss a little bit in detail about the roof, floor, medial wall and lateral wall of the orbit, so that we'll be able to now remember which are the bones creating which walls, or whether it is medial or lateral or roof or floor. Right, Here now we'll discuss about the first wall, that is nothing but the roof of the orbit. You can see that this is the roof of the orbit. Okay, try to remember it has a shape of triangular shape. Okay, it has a shape of a triangle, that is the shape of the roof. Okay, you can see it here. And now which bones are making the roof? It's clear, this is a frontal bone. You can see this this beige color. Okay, that is the frontal bone and the lesser wing of sphenoid. So roof is made up of frontal bone and lesser wing of sphenoid. And what are the other features about roof? One, it is having an optic foramen or canal. Okay, so what is a canal or a foramen? Both are same. It is a small opening, okay, through which the optic nerve is going out of the orbit. Now you need to imagine the eyeball is sitting here, optic nerve is starting from the back of the eyeball, okay, and it has to reach the brain, isn't it? So the eyeball is here, optic nerve is behind, and through this hole, this is the optic canal, through this hole the nerve is going out of the eye. So that is optic foramen or optic canal. And there are a couple more things. Okay, that is, one is fossa for the lacrimal gland and trochlea, okay, tendon for superior oblique muscle. These two things I will discuss in the next slide. So quick reminder about walls, means the roof. Remember about its shape, which is triangular. Okay, two bones are involved in making the roof, that is the frontal bone and lesser wing of sphenoid. And it has also a small opening behind. Why that opening? Because the optic nerve has to go out of the orbit and go to the brain. So it is going through the optic foramen or optic canal. It has a space. Fossa is nothing but a space for the lacrimal gland. We know that this is a lacrimal gland here. It is located here and it is producing the tear, and tear comes over here, and this is the puncta here and puncta here. It will collect the tear and it goes to the lacrimal sac and into the throat. So this is how the tear is draining. So your lacrimal gland is located in the roof of the orbit. Where is the roof? This is a roof. And which side of the roof? It is the superior-lateral side of the roof. Okay, we'll see that in detail in the next slide. Alright, so this is the continuation from the previous slide, and we can easily understand now. Okay, this is the roof. Actually roof is not there, which is cut from above so that we will be able to see through it. So it has two portions, right? One is fossa for lacrimal gland. Fossa is nothing but there is a space. Okay, there is a space for the lacrimal gland to sit, and we already said that, okay, the position of the lacrimal gland is not at the superior portion, it is the superior temporal portion of the roof. Okay, so superior temporal, let me take a pen and try to write. Okay, the position of lacrimal gland is superior temporal. Right, so that is the position of the lacrimal gland. So this is the superior temporal portion of the orbit. That is the position where the lacrimal gland is situated. Also we can say that it is at the temporal portion of the roof of the orbit, that is the lacrimal gland is located. Now the second thing what you need to remember about the roof is there is something called trochlea. Now you can see the muscles over here. There is a muscle here. If you can remember the name, this is a superior rectus muscle, and you can see another muscle coming in, okay, from the lateral side. So this is the lateral rectus, and there is a muscle coming here, okay, at the medial side, that is a medial rectus. And you can see one muscle that is coming from here, right? You can just follow the trace of the line, okay, and it is passing through like this, and it is coming to the superior portion. So this muscle is known as superior oblique muscle. Okay, now this superior oblique muscle is now coming through a pulley, okay, or coming through a pulley, or this pulley is known as trochlea. Okay, so trochlea is located at the superior nasal portion of the orbit. Okay, so lacrimal gland is located at the superior temporal. Trochlea is located at the superior nasal. See, because this is the medial wall and the nose is here, the nose is here, okay, and the superior nasal portion of the orbital roof or orbit is the trochlea located. So we need to remember a couple of things in orbital of roof, right? Orbital roof, that is the shape of the roof. Okay, we know that it is triangular, right? And the second one is which bones are making up for the roof. We learned that frontal bone and the lesser wing of sphenoid, and it has the lacrimal gland as well as it has the trochlea. So trochlea is nothing but the pulley through which the superior oblique muscle is passing through, which is located at the superior nasal portion of the orbit, and lacrimal gland, which is located at the superior temporal portion of the orbit. So your trochlea will come somewhere like this. This is a position where the trochlea will come, okay, or maybe slightly lower down. Okay, this is the position where the trochlea will come, and the superior oblique muscle will pass through it and will attach on the eyeball somewhere here. Okay, not on the eyelid. Imagine behind the eyelid, that is on the eyeball. Right, so we discussed about the roof. Okay, now we'll discuss about the floor. Okay, we are not having I'm not discussing so many points on the floor. Again, the shape of the floor, okay, the shape of the floor, okay, it is like a triangle. Okay, that is where the shape is triangle, and it is made up of three bones: maxilla, zygomatic, and palatine. Okay, so you can see that this is a zygomatic bone. Okay, the floor is starting from here to here. Zygomatic, maxilla, and palatine. Palatine is a small bone here which we cannot see it. Okay, so floor, we are not discussing so many points. One, it has a shape of triangular shape, and it is made up of three bones: maxilla, zygomatic, and palatine. All right, so here we'll discuss about the medial wall. So far we discussed about the roof we discussed, floor we discussed. Now we discussed about the medial wall. You can see that in the medial wall, here the medial wall's shape is more rectangular. Okay, rectangular, right? Medial wall, the roof was, or the superior wall or the roof was having a triangular shape. Floor had a triangular shape. Medial wall is like more like a rectangular shape. Excuse me. Now there is one more feature or important thing about it. It is the thinnest wall. Okay, among roof, floor, medial wall, and lateral wall, medial wall is the thinnest one. Okay, now we can easily try to remember the bones now. Okay, this maxilla is coming towards here, so maxilla is a part of the medial wall. Lacrimal, right? This is lacrimal, and this is ethmoid. So there are three bones that is making up the medial wall. Okay, the maxilla, lacrimal, and ethmoid. So this ethmoid bone has one more name. Okay, that is called lamina papyracea. Papyracea is nothing but paper. So what it says, the ethmoid bone is thin like a paper. That is why the ethmoid has another name, lamina papyracea. Okay, lamina papyracea. Okay, I forgot to tell the fourth bone that is making up the medial wall, that is a sphenoid. Okay, you can see as the lesser wing of the sphenoid is also contributing, a small part is contributing to the medial wall. So medial wall has four components: your maxilla, lacrimal, ethmoid and sphenoid, or in fact the lesser wing of sphenoid. And another important feature is this medial wall is the thinnest one, and mainly because the ethmoid bone, because the major portion of the medial wall is from ethmoid bone. This ethmoid bone is very thin like a paper, and that is why the medial wall is the thinnest one. Okay, in this slide we'll discuss about the lateral wall. So that is the fourth one remaining, right? So your roof, floor, medial wall and lateral wall. First we look at the shape. Okay, roughly triangular. Okay, roughly triangular. So roof had a triangular shape, floor is having a triangular shape, lateral wall is also having a roughly triangular shape. Only medial wall has a different shape, that is the rectangular shape. Okay, so lateral wall is triangular. Okay, now which are the bones that is making up? You can easily see it. This is one and this is another one. Okay, this is a roof, right? So what is this bone? This is a zygomatic that is in front, and another one that is making up the lateral wall, that is the sphenoid. Which part of sphenoid? Greater wing of sphenoid. Okay, so easy to remember now. This is zygomatic and greater wing of sphenoid. Now we have completed all the bones. Okay, all the 7 bones, and how these 7 bones are contributing into the formation of each of the orbital wall. Okay, a quick review: frontal bone and lesser wing of sphenoid is making up the roof. You have your maxilla and zygomatic, and a small bone inside palatine is making up the floor. And when you're coming to the medial wall, we have 4 bones. One is again, that is your maxilla, your lacrimal, your ethmoid, which is thin like a paper, and the lesser wing of sphenoid. So we have 4 bones that is making up the medial wall. And when you come to the lateral wall, you have 2 bones mainly, that is your zygomatic and sphenoid. Which wing of sphenoid? Greater wing of sphenoid. Now before we conclude on this, you can see this bone is a lacrimal bone, right? Lacrimal bone, which is having the lacrimal sac. Okay, the lacrimal gland is here. It will provide tear into the eye. Imagine your eyeball is here, your upper eyelid, your lower eyelid is here, puncta is here. It will collect the tear through puncta, and this puncta will send the tear into lacrimal sac. Okay, so this lacrimal sac is sitting here on the lacrimal bone, so that is why the name lacrimal bone. Okay, please do not confuse. Okay, lacrimal gland is not sitting in the lacrimal bone. Lacrimal gland is sitting here. What is the location? Superior temporal portion of the orbit is the lacrimal gland. Now what is sitting on the lacrimal sac? Sorry, lacrimal bone. On the lacrimal bone we have the lacrimal sac. Okay, so I hope you understood. First you learn the name of the orbital bones, and then try to remember its position in the orbit, so that we'll be able to easily remember which bones are contributing to which walls of the orbit. Right, so quickly in this slide we'll discuss about orbital foramina or fissures. Okay, so what is foramina and fissures? It is nothing but gaps and openings on the orbit. Right, so orbit has 3 major foramens or fissures. Okay, you can see that this, when you look at the orbit, it is not a fully closed one. Okay, there are openings here, right? And we already discussed about an opening here, that is the optic canal or optic foramen through which optic nerve is going out. Okay, there are a couple of other openings also. You can see one opening here, okay, and you can see a small opening here. And why the orbit has these openings? We discussed that in the orbit has blood vessels and orbit has nerves, right? These blood vessels and nerves has to go out of the orbit, or through this opening those blood vessels are coming to the eyeball. So that is why there are openings here, right? Okay, so what are the names of these openings? One is optic canal. Okay, optic canal is nothing but this is the optic canal. Now two fissures are there. Okay, canal will be mostly round in shape, that is why we call it as canal. Now fissure is more like gaps. Okay, it does not have a round shape, it is a gap between the bones. So what are the two fissures? Superior orbital fissure, inferior orbital fissure. So it is easy to remember a fissure at the superior side and a fissure at the inferior side. Okay, superior orbital fissure and inferior orbital fissure. And you can easily say what is superior orbital fissure? It is nothing but gap between the lesser wing of sphenoid and greater wing of sphenoid, through which a number of blood vessels and nerves are passing through, which we will not be discussing it here, but later when we are discussing about the cranial nerves we can discuss about these things. So remember that foramens or fissures are nothing but gaps or openings in the orbit through which the blood vessels and the nerves can either come towards the eyeball or it can go out of the orbit. Three things you need to remember: optic canal, okay, through which the optic nerve is going out. Okay, another two fissures, superior orbital fissure and inferior orbital fissure. Superior orbital fissure and inferior orbital fissure. Right, so we'll discuss about a little bit more interesting thing here, that is called paranasal sinuses. Now I hope you might have heard about sinusitis. Okay, whenever we are getting cold, we sometimes will feel like our nose is blocked so much, and because of cold you're getting headache. Okay, so that is called sinusitis. So let me just write it for you. Okay, sinusitis. Okay, so it is nothing but sinusitis means inflammation of the sinus. Okay, sinusitis. Okay, so now what are those sinuses and what are the function of that sinuses? So we have four sinuses. Okay, those sinuses are known as paranasal sinuses. So now again, what is the meaning of paranasal? Now this is your nose, right? Sinuses that is surrounding the nose. Sinuses that is surrounding the nose, that is why it is known as paranasal sinuses. You can see that there are no sinuses here. All the sinuses are connected to nose. Okay, so what are sinuses? These are air-filled cavities. Now, what is a cavity? We already know it is an empty space, right? This is the orbit, bony cavity. It is an empty space if you see without the eye, but that empty space is filled with the eyeball. But the paranasal sinuses are air-filled cavities. Okay, so spaces within the bone that is empty but is filled with air. Now why these sinuses are formed? Okay, if you have some empty spaces in the orbital bones, it will reduce the weight of the skull. Okay, the weight of the skull will be lesser, and also it helps to resonate the voice. Resonate is nothing but it is help to make our voice more better to, or it will have that particular sound and will be able to resonate the voice. Okay, so to adjust the voice, we can say that resonating the voice. Okay, so what are the name of those sinuses? One is frontal sinus, and you can remember now it will be associated with the frontal bone here. Okay, this is a frontal bone, this is a frontal bone, frontal sinus. And remember that all are connected towards the nose. Second one, maxillary sinus. Okay, now this is the maxillary bone, and you can see this is a maxillary sinus. Ethmoidal sinus. Okay, ethmoidal sinus is here, right, towards the ethmoidal bone on the ethmoid, and sphenoidal sinus, okay, on the sphenoid bone. Okay, it will be difficult to observe from the anterior view or differentiate from the anterior, ethmoidal and sphenoid, and we already know what is the sphenoid bone, right, and the ethmoid bone. Remember that all these are connected to the nose or the nasal cavity. That is why it is known as paranasal sinuses. So try to remember the name of those 4 sinuses, and also try to remember which is the largest sinus. Largest one is definitely the maxillary sinus. Alright, so we come to the last slide of the presentation. So here we'll be discussing about what are the contents, okay, of the orbit. So now we discussed about so many different 7 types of bones that is making up the orbit. We also discussed the shape and dimensions of the orbit. We also discussed the walls, 4 different walls of the orbit, which orbital bones are contributing to the formation of those walls. And we also discussed about the openings, the foramina and fissures in the orbit, why those openings are there, for that blood vessels and the nerve tissues can come and go out of the orbit, right? And now this is a concluding slide, okay, about the contents of the orbit. What are the contents? Definitely eyeball is the content of the orbit. You can see it, eyeball. Different muscles, okay, superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique, and levator palpebrae superioris. So this we will discuss in the extraocular muscles in detail, so I'm just leaving it like LPS. Okay, you have your superior rectus, you have your lateral rectus, you have your medial rectus, okay, and we cannot see the inferior rectus, it is underneath. You have your superior oblique, okay. Now you remember the name of this structure is trochlea, right? So you have your superior oblique, okay, coming and taking means attaching to the eyeball in an oblique manner. That is why it is having superior oblique. And also you cannot see the inferior oblique, it is at the inferior portion of the eyeball. So superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique, and levator palpebrae superioris. Okay. If I remember, we have discussed about this, the name in Introduction to Optometry, right? So the third content is blood vessels. You can see so many different blood vessels, okay, which is coming, and we also discussed blood vessel has to go inside the eyeball to supply some structures inside. It has go to the choroid, it has go to the ciliary body, or it has go to the vascular coat of the eyeball, that is the uvea. So blood vessels, okay, that includes arteries and veins, and it has different nerves, okay. And of course optic nerve, okay, we cannot see the optic nerve here because it is underneath the superior rectus. Optic nerve that is going out of the eyeball, oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, and facial nerve. These many different nerves are also coming into the eyeball, okay. So now you may be, do you remember those superior orbital fissure and inferior orbital fissure through which the nerves and blood vessels are coming into the eyeball or outside the orbit? Of course. So these are the different nerves, and we'll discuss about these nerves slightly more in detail when we're discussing about the cranial nerves. Okay, so after that, connective tissue. Connective tissue is nothing but the tissue that is connecting between the organs or between the structures. Periorbita, orbital septum, and orbital fat. Now you remember at least orbital fat. These 2 things we will learn a little bit more in detail when we are taking the ocular disease course. So a final recap. The orbit has eyeball muscles. Remember the types of the different extraocular muscles. I have written only the short forms. Try to remember the expanded ones. It has blood vessels, arteries and veins. It has nerves. What are the different cranial nerves? Optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducens and facial, and connective tissue like orbital fat. Okay, so that concludes the presentation of orbit. And why I have taken orbit before extraocular muscle is it is easy to explain extraocular muscles when we complete the orbit. Okay, so the next presentation will be about extraocular muscles. Okay, then happy reading, happy learning, and we'll be having a couple of online quizzes also coming in the next week probably. Okay, okay then. Assalamu alaikum.